everyone. Welcome to my YouTube channel. If you don't know who I am, hi, I'm Nefisa Guest. In today's episode, I'm taking you all through my days in my life as a nurse working in Ghana. So this is Wellness Clinic. I worked at Wellness Clinic during the day, and then I worked at OPD during the night. So I came to work that day early in the morning, and then I arranged the place. So this is where you used to check the height. I don't know the name. I don't know. And then this is where we used to check the weight, the weighing scale. Yeah, and then we laid the bed, and this is a full tour at the wellness clinic. Now at the wellness clinic, we do breast examination, we check the weight of a patient, and then we also check their height. And this is a walk-in clinic, okay?
Many unbearable hours later.
So on this day, this patient came to check his BP, and then we checked the BP. Yeah. So the BP is normally 120/80, which is normal. But if it is below, it's okay. And then if it is higher than 130 going, then it's bad. So this patient had a normal BP. We usually go out to do health talk, that is going around educating people on how to prevent malaria and then typhoid fever. Now after that, I came to the washroom to just use the washroom. Yeah, normal girls things, yeah. And then that's me again, trying to do whatever I do whilst people are not watching. Yep. And I was trying if the water was flowing, but on this day, the water wasn't flowing. So that was the only water coming. Yeah. It was now time for us to close that day. I couldn't vlog that much. But then after we close, we usually pack everything. That is the linen on the bed. We fold it like this. And then I cleaned up the place. Yeah. And we packed the chairs as well. These are the chairs. We pack the chairs, and then we ensure that every place is well tidied, like well cleaned before we go. Because in the morning when we come to work, people would start coming inside, you get it. So I was just making sure that the curtains were like intact, and then check if everything was okay. So this is a little tour after checking if everything was okay. Yeah. Now the wellness clinic, usually we refer patients to the OPD after we check them. So let's say the breast is having an issue or something, or a lump is inside the breast, we refer them to OPD to see a doctor. Yeah. And after checking that everything was okay, it was time for me to go home. Yep, and this was me going home after my work day. Yeah. So I ensure that the place is locked, and then I return the key to its normal location. Yep. And that's me going to the key station to return the key. So this was the following week. I was then sent to the OPD. Welcome to the OPD, where we do triaging. We check the most pressing needs first, the vitals table, and then on this day the patients were not around because it was in the evening. I decided to go and wash my hands after my half shift when I came earlier that evening. Yeah, I checked a couple of vitals, and then I decided to do some hand hygiene. As nurses, we wash our hands every moments after contacting a patient, even before contacting a patient, and even after contacting a patient. So I did my hand hygiene and then went back to my station. Now welcome to the triage table, where we check the vitals. We do weight checking. So this place is just like the wellness clinic. We also check the weight. So these rotation nurses also came here to check their weight to see if they are growing fat or growing lean. Yeah. And then after they left, I was given a task to write the vitals of some patients who came earlier that evening. Yeah. So my in charge asked me to write, since I'm the only rotation nurse working for 9 shifts that day. So rotation nurses are mini staff nurses, okay? So we are there in place of the staff nurses. So everything, usually I was the one doing it. Yep. Now I went inside to input all the information we got at the triage table onto the PC. Na me bought PC no so back the PC went off. Oh, so yeah, so this was me writing something, then boom, it went off. Yeah, then I decided to go back to my station. Now I went to visit the washroom because I'm orienting myself. They didn't do any orientation. So I went around looking for the washroom and boom, this was our washroom. Yep. And then I was doing a washroom tour. So this was how the washroom looks like. Very cute, small. This is the nurses' washroom. We don't share it with patients, okay? So patients have their washroom and then nurses also have our washrooms. Yep.
Early the next morning.
Now I went to sleep. So this was the next morning. I fell asleep and then I woke up the next morning. And then, yep, I did some outfit store again. Outfit check again. Yeah, and then this is how the washroom looks like again. Yep. Now we can't speak to patients with bad breath. So we have to brush our teeth and then go outside to meet our patients. And as nurses, we brush our teeth even when you go for 9 shifts. Take your brush along. Okay? So if you are an aspiring nurse, this is a video for you just to see how nursing life looks like. Yeah. And I want you all to know the profession you all are getting yourselves into. I hope this video would be educational for you or something interesting for you. I just hope so.
Maybe time. Actually, being fierce, 8. I'm not saying. That's all boy. The boy. I just had to borrow how many days? I'm not saying. Starting, I'm not saying.
Nenda dokita wam nde timasne yupoena yari sorry ena na
But
mumna
the same person say, oh, boy, one. Because of one can crack. It's a statue, that bang. Oh, but like, could watch them who are.
oh I imagine so
Any words? It's a banner, a banner, a banner. Also, putting out.
you
But I'll tell you,
achema
actually, I'm saying, listen. This is. Washroom is 9. Yeah, it's 9. But you're putting out in us. And then second July. Second July. Good morning. Good morning. But you're putting out now.
no mbete
That's my favorite.
akabaka
I'll come. Good morning.